Welcome to the Talk to Tom show. Talk to Tom. 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 Try saying that fast 15 times. Hey, let's go. Hey, Doc. What's the real deal on plantar fasciitis? All right, Doc. In previous episodes, I've given you some other dirty words like shin splints and stress fractures. Now I've got two more dirty words for you. These might not be as sexy as the other ones, but I'm telling you, in the athletic community, nobody wants to hear the words plantar fasciitis. Please tell us what that is and how to get rid of it.
Well, plantar fasciitis is actually heel pain. It's a big fancy word for heel pain. Anytime you do any type of repetitive activity, it might be walking, it might be running, you get pain at the bottom of the foot right at the heel, and it hurts right when you strike your foot onto the ground. Sometimes that pain can be severe, almost like you're walking on glass. And a lot of my patients will say it hurts first thing in the morning when they get out of bed. They can hardly walk to the bathroom, and then it gradually gets better over time. And what we're finding is a lot of these people have tightness of their Achilles tendon. When the muscle, the calf muscle in the back of the leg is tight, the bottom of the foot, which is the fascia where the arch is, pulls. And when it pulls from the bone, you get pain. You get a lot of inflammation in that area. And anytime you put your foot down on the ground, it hurts. A couple of ways that we treat that. Number one, you got to stretch. A lot of runners don't like to stretch.
Right.
If you stretch first thing in the morning, during the day, and in the evening, you're going to lengthen that Achilles tendon and also pull on the plantar fascia, have less inflammation at that heel. Some other things that you can look at is cushion your shoe. Just wearing a gel insole sometimes cushions every time you walk, and you have immediate pain relief. You can also look at icing. I like to take a frozen water bottle and roll the foot over top of it. It actually massages like a rolling pin, but the cold helps stop the inflammation. Every once in a while we have someone we have to do a cortisone injection, and if we find a point area that hurts, we can inject right into that spot, stop the inflammation, and calm the pain down enough so that you can be more aggressive with your stretching.
So, can you feel it coming on? I got to tell you, a lot of the things that we've talked about, I've had, but I've never had the plantar fasciitis, but I've had a little bit of heel discomfort. How do you feel it? Does it come on just like a light switch, or does it come on slowly over time?
Most of the time it starts very mildly and then it increases suddenly. So what you want to do is come in and see me and have me evaluate it so I can make sure that that's the problem and that you don't have a tear. It can tear in worst case scenario. That's usually a sudden onset of pain. But also we want to make sure you're doing the proper stretches, make sure that the length of the muscle and tendon is appropriate, and that you have proper shoe wear. All of these are things that I can help you address to help get rid of the pain sooner.
What about downtime? Every athlete, when we're done with these segments, they're like, okay, make sure, how long? I'm sure when people are in your office, how long? How long am I going to be down? What's the healing time for plantars?
It all depends on the severity of it when you come in. It's always important to cross-train, and that's something I've talked about in other segments. You can still exercise with other activities while you allow it to rest. Typically, it takes about 4 to 6 weeks to get better, but it may be longer if you don't allow a proper rest time.
Thanks, Doc. Next time, we're going to talk about the dirty word. Hopefully, you don't have any problem with your Achilles. We'll see you next time.
For more information, call 214-496-9700 or go to www.eliteortholascolinas.com.
Out of the blue media. Creativity, personal attention, never stop.